Tonight we're talking about systemic issues, systemic diseases, and how they would affect your foot. In podiatry, sometimes we see things for the first time. We are able to find some evidence of systemic issues that are going on with you, even if they're not diagnosed by your primary care physician. We do manage the chronic things, the wounds, the infections, the anything that's an ongoing problem, like your ankle instability, sending you to physical therapy. Or, as Dr. Keel was talking about, the last line, where we've tried a bunch of other things, and the next thing is to get it taken care of surgically. First, we'll start with our most common diseases that we see. A lot of people, whether they know it or not, they have some degree of compromise of their circulation. That kind of thing goes with age. The second thing would be arthritis in general. You can have one joint, you can have arthritis throughout your entire body. And last but not least is diabetes, which is a very interesting combination of all these. So first, peripheral arterial disease. Your signs and symptoms that you should look out for yourself would be cold extremities that just don't seem to warm up. With activity, big red flags that we see with activity are where you can walk, say, halfway through the grocery store and you just can't make it through the rest. Risk factors really associated with peripheral arterial disease. Here we are. High cholesterol, yes. Blood pressure, yes. Diabetes, yes. Over 80% of the patients with severe peripheral arterial disease were current or long-time former smokers. It's the biggest risk factor. Next topic is arthritis. So for this lecture, we're just separated into an inflammatory arthritis and an osteoarthritis. Your inflammatory arthritis, your most common one, I think, is gout and rheumatoid. Osteoarthritis is the old age, the wear and tear of a joint or multiple joints because of occupation, because of sports. Your osteoarthritis, it's the wearing away of those cartilage, and you got the bone-on-bone grinding there. Your inflammatory arthritis is actually where the body itself and the joint itself, through your own immune response, attacks the cartilage, attacks the bone underneath the cartilage, and really just makes that joint flare up for no apparent reason. So long-term consequences of arthritis in general, whether it's inflammatory or whether it's osteoarthritis, is the destruction of the joint itself, whether it just be wearing away of cartilage or holes poked in the cartilage, or whether it's the inflammatory response that kills the joint. Or you can get deformity, especially from rheumatoid arthritis. So there is quite a wide range of treatments, and it depends on the pain that is causing the patient, the deformity. If the medicinal therapies don't work, we go to bracing or orthotic inserts. If none of those work, joint salvage, arthroscopy, clean up the joint. Joint replacement's a good option too. Get as much information as you possibly can for yourself, whether it's through the internet, whether it's through your doctors, and it will save heartache in the long run.